Hello everybody, welcome to BD Nurse Econ channel. I am here Mrs. Brammu, Assistant Professor, SNS College of Nursing, to share a few words on Orem Dorothy Orem self-care deficit theory. As we were discussing on the previous theories, so this theory is quite interesting based on the patient self-care. Let us see the introduction of this theory. So coming to the introduction of Orem, Dorotheus Elizabeth Orem, she was born in the year 1914 on July 15, and this theory was named after the founder itself, and hence it has the theory name as Orem self-care deficit theory. In this theory, she has defined nursing as it is the art of assisting the others, that is, the individual who is sick, in order to provide and maintain the self-care to improve the human functioning at home level of all effectiveness. So in this theory, it is going to highlight that the individual will be able to initiate and perform their own on their own, maintaining their life, health and being. So this is the small background of the theory, that she was studying in Washington DC in the year 1930s, and she completed in the year 1939 a BSc, and she also completed a MSc in nursing in 1945 at the Catholic University of America. So coming to the assumptions of the theory, so some may speak on that this theory will be able to focus to the where it maintains to stay alive and remain functional, and it also engages the humans, that is the nurses, on a constant communication and get connected among themselves as well as with their environment. To some, they may assume that this theory will act as deliberately to identify the needs, as well as it also helps to make needed judgments. And to some, it may be life-sustaining and function-regulating action. To few, the human agency is mostly exercised in discovering, developing, and transmitting to the others ways and means to identify the needs, inputs into self and others. So to the major concepts of the theory. So this theory is basically focusing on the four major aspects, which is nursing, humans, environment, and health. So here the nurse is actively and intelligently participating in medical care, and also she gives the care, individualized patient care, and also she maintains the orders from the physician whenever needed. Here the humans, here they are the men or the women or the children who are care under the particular nurses, might be under the certain units who receive the direct patient care. Environment is the surrounding areas where physical, chemical and biological factors, as well as in this theory, family, culture and community are also being involved. Health is being structurally and functionally the whole sound, and also health is encompasses both the health of the individual and humans, and human health is to reflect and symbolize experience as well as communicate with us. The interrelationship among the concepts is that it is going to interact with agency, who is the patient himself, patient agency, who is the nurse, as well as the society. So here in this picture, you can identify that this theory is being totally indulged with Orem self-care model. So in this, what they do is that to continue further, as we were discussing, whether it is wholly compensatory or partially compensatory, or might be the patient is able to go under supportive educative system. So in this wholly compensatory system, you have nursing action on the other side, and the other side where the patient action is totally limited. Might be in cases of comatose, or patient who are under 5, or patient who are mentally unsound, or patient who are unable to do their daily activity due to paraplegia or hemiplegia. So here the nurse will be trying to accomplish the patient's therapeutic self-care, and also she engages in self-care of the patients, and she protects and as well as support the patient. In case of a wholly compensatory system, you can see the nursing action will be covered under majorly six aspects, and the three aspects will be focused on patient action. That is, here the nurse will be performing self-care measures to the patient, compensates to self-care limitations of the patient as well, and assists the patient whenever required. On the other hand, you can see here the patient is performing some limited amount of activity and also regulating the self-care agency and also accepts the care that is being received from the patient. In case of partially compensated system, here the patient is able to do the self-care here, whereas the nurse only gives the exercises or might be the development of self-care agency alone. So theory of self-care, to whom it is going to be applicable? Yes, you have to ask certain questions. Is the patient able to meet their own healthcare needs on their own? Is there any need for nursing care for that particular patient? And if necessary, what type of nursing care can be given? Whether it is wholly compensatory, partially, or totally compensatory. And whether the patient is able to maintain their health on their own. And always have a goal-oriented activity that is being learned. The actions are directed towards meeting three different types of self-care. That is self-care, self-care agency, self-care requisites. So the ability to perform self-care with self-care agency and dependent care agency, we call it as self-care agency. So here this can be get affected depending on the age of the patient, developmental state of the patient, life experiences, socio-economical or socio-cultural orientation, health and available resources. So the universal self-care requisites is that here Dorothea Orem has been giving that such as maintenance of air, water and food to the individual and also assisting in elimination process, maintaining the activity, balance between the activity and rest, preventing hazards, that is promoting safety environment to the patient as well as promotion of human function. So the last two will be developmental self-care requisites. Here where you can see where a client might be in a general example adjusting to a new job according to the developmental process and adjusting to the body changes. For example, in case of an amputated leg for a diabetic patient, how they adjust to the new body changes. Healthcare deviation self-care requisites is that being self-aware of defects and attending, as well as here the patient will be able to carry out the medically prescribed measures, able to learn with the defect, as well as they will be willing to seek and secure medical assistance. So with that, I would like to conclude today's topic. So here mainly you have to understand where the nurse stands and where the patient stands. Whether patient needs wholly the self-care to be met or partially to be met, or the patient needs only just exercise or education that is being done by a detailed nursing assessment. With this we will stop for today. Thank you.